Some people have said that recovery from drugs is a process, not a destination. And so the question becomes, aren't you ever done with them? Aren't you ever cured from using drugs? And the answer is yes and no. Anyone who's ever been addicted to a drug or alcohol is 13 times more likely than any other person in the population of becoming addicted again. So even though their behavior is better, even though they're psychologically recuperated from their period of addiction, they remain at significantly greater risk of becoming addicted again than another person. And in that sense, they can't leave that history of drug addiction behind. And so the question becomes, why is that? And I think the answer is really twofold. One is genetics. That is, people who are genetically prone to addiction are often prone to multiple addictions. It's not to a specific drug, but to a whole host of drugs and other emotional problems. And so even though they may have overcome their addiction, the risk is still there, that if they're under stress or under pressure, that they're going to respond in the same way they did many years before. The second thing that plays a role is that although the brain heals dramatically, and we see this at promises all the time, is that people are so remarkably better. And if you were to talk to our alumni, you would be amazed at the transformation in their lives. But the fact that the brain is functioning well doesn't mean that it's normal. That is, it doesn't mean it's behaving exactly the way it would if it had never been exposed to drugs. And people say, well, how do you know? And there's one really clear medical example that shows that that's the case. And that example is called cocaine-induced or amphetamine-induced psychosis. People who use stimulants like cocaine and amphetamines, if they use them at really high dosages for a year or more, frequently develop paranoid delusions, hallucinations, fear that they're being followed, intense anxiety. And if they stop using, that tends to go away. And after many months, it seems to be gone completely. And so we say, okay, the person's recovered. They don't have the paranoia, they don't think they're being followed, they don't think people are conspiring against them. It's gone. Their brain has healed. But it turns out that that's only partially true, because even if they use cocaine once, they have about a 50-50 chance of that psychosis coming back. So what it took a year of chronic, high-dose abuse to create takes only a single dose to come back. And what that tells me is that the brain, even though it's functioning normally, is not fully healed. And we think that one of the reasons that people relapse when they're under stress is that it triggers abnormal amounts of dopamine and glutamate and other stress-related neurotransmitters, even though the person has been doing much better over months or even years. Now, the good news is that there is a lot of healing. And that, generally speaking, the risk of relapse, if someone has remained clean and sober for a year, is very low. It's less than 10% per year. So that people who make it through the first year and whose brains have had a chance to recover and stabilize and who have had a chance to learn new psychological skills and to manage through their sense of low self-esteem and empathy and memory, those people tend to do well for not just months, but years and years and years.